This is not a drill. This is not the time to give up.
That's when I had the first cough.
That until and unless we become self-disciplined, this disease is going to finish us.
Ilikuwa noma sana.
It was a bit scary.
It can kill anybody at any time.
We have therefore made the assessment that COVID-19 can be characterized as a pandemic.
As the more the virus spreads, the higher the likelihood of mutations. However, some of these changes are concerning.
Towards the end of 2019, hospitals in Wuhan, the capital of Hubei province in China, noticed a spike in respiratory infections, with most patients having connections to the Huanan seafood market. The infections were initially thought to be acute pneumonia. There was, however, something different about the disease owing to its aggressiveness, resistance to drugs, and the quick pace with which it spread. 3 months later, the government was fighting the infection in mainland China, but it had already spread to the rest of the world. The disease was named by WHO as COVID-19, SARS-CoV-2, a new coronavirus.
This is not a drill. This is not the time to give up. This is not a time for excuses. This is a time for pulling out all the stops.
This is a very serious outbreak and it has the potential to grow. But we need to balance that in terms of the number of people infected.
This epidemic is a threat for every country, rich and poor.
In Kenya, the Ministry of Health, the World Health Organization, key partners and leading hospitals had been on high alert as the disease caused havoc around the world.
Fellow Kenyans, I want to inform you that the Ministry of Health has confirmed the first coronavirus case in Kenya.
This is a global issue, which is the coronavirus, and the disaster we are getting is going to affect the entire economy.
The National Emergency Response Committee on Coronavirus Preparedness will continue to provide strategic leadership, working through whole government approach to respond to this case in the implementation of mitigation measures.
There was no taking chances as the state went into overdrive to heighten surveillance and monitor the disease. It cautioned citizens to maintain basic hand and respiratory hygiene and safe food practices, avoid close contact with people suffering from acute respiratory infections, and report cases of anyone showing respiratory illnesses, especially those with recent travel history.
Please, 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 let's work together on this one. I beseech you. Asanteni.
The government has confirmed one case of the coronavirus in the country.
The first to test positive, a result that changed the country's handling of the pandemic.
The woman is currently at an isolation ward in Panache Hospital.
On March 13th, 2020, the nation trembled as the first case of COVID-19 on Kenyan soil was reported. A 29-year-old lady traveling from the United States via London became the first in the country to be infected. The patient, now christened Patient Zero, was clinically stable and was admitted at Mbagathi Hospital in Nairobi.
I think it was around March 7th. That's when I had the first cough. Then someone joked about it and said, maybe it's corona. Then we laughed about it. We said, no, it can't be common. There was no fever. The next day is when I became a little concerned, and I called the people who were seated next to me on the plane, and I asked them how they were feeling. They said, one of them said they were having a cough and a fever. I was very worried because I'd interacted with people in the house. So that was a concern for me, and we talked about it with the people I was living with. I told them there's a chance that this can be the virus, and if it comes that way, I would like all of you to just come out and also tell the ministry that you had been in contact with me.
Given her stable condition, some members of the public even doubted whether she had COVID-19 or it was just a made-up story.
We are all very proud of both of you. We are thankful to God that you have managed to go through treatment and you are now well and able to go about your businesses once again and continue with your lives. I'm looking forward to seeing you guys soon. God bless you all.
The government swung into action, suspending all public gatherings, inter-school sporting activities, and travel outside the country. Before the week was over, 3 more patients were diagnosed with COVID-19, causing the state to issue even stricter measures in an attempt to halt further spreads of the virus.
We have received confirmation of another 3 cases of coronavirus, following tests that were carried out by the National Influenza Center as well as Cambridge laboratories in the country.
Travel from affected countries was indefinitely suspended. Government and private sector employees were required to work from home, while the use of physical cash was strongly discouraged and congressional meetings were banned. And there was more.
I've come here this evening to meet the Kenyans who have returned on this flight from Guangzhou, China. So we are happy that they've been able to come because we had to arrange this flight in very challenging circumstances and at very short notice.
We have been quarantined for like 4 months, some of us 4 months, some of us 5 months. Not doing any job, not doing any business, we're just at home. So it's very, very relieving to be home.
Those who entered the country yesterday were duly monitored. Their recommendations for quarantine, self-quarantine if necessary, and contact tracing and all these things in a collaborative manner with other arms of government, including our immigration authorities.
The COVID-19 virus continued to spread her tentacles around the country. By the end of March, a total of 59 cases had been positively diagnosed. Unlike the early patients who were all largely in Nairobi, the pandemic by now appeared to have spread to 4 other counties, namely Kajiado, Mombasa, Kilifi, and Kwale. On the economic front, the economy was taking a severe beating. Sectors such as floriculture, that in the previous years had earned the economy upwards of $1 billion, was amongst the early casualties as demand for Kenyan cut flowers crashed and leading markets in Europe shut.
We have farms that, because of the effect we had on COVID, could not just manage. And they had to shut. this business is not easy. But COVID just came in to compound some of the challenges that we had. When now we did not have a demand and we are not exporting as we usually do, it had an immediate impact, negative impact on the industry and the economy.
Other sectors that bore the brunt of the economy were tourism and entertainment, education and retail sectors.
Tourism is an export product. It's like tea and coffee. We need tourists to come in from outside. And we really didn't see the impact of COVID until around March. So obviously we saw the numbers really reducing to the point where hotels were empty. And we managed to weather the storm, for the 4 months that we were shut. So eventually we had to shut all our hotels because we had no business. And I'm pretty optimistic about the future, and I believe that things will get better. Things will be different, but things will get better.
It was not only the big corporates experiencing the heat from the pandemic.
Tunataka kumwambia serikali na mtukufu rais ya kwamba tunakuunga mkono katika juhudi ya kupambana na corona. Lakini kitu moja ambaye tafadhali tungeomba ni ungeshauriana na wale ambao wanaendesha biashara ili kwa upande moja tuangamize corona na tupambane nayo, na upande mwingine tujaribu kuendelea na biashara.
Mimi kama DJ personally nimekuwa nikiwork let's say 6 days in a week. Na sasa like 2 months now sijakuwa na job.
Getting clients was a bit hard. People were working from home, which meant they were not making their hair. People were afraid of getting in contact. And those who came wanted to take the shortest time possible at the salon.
Okay, vile corona ilitokea, tulibaki tu sana tuko down. Kuna vile kidogo tumeumia mpaka kuna watu walienda maushago, wengine kufunga makazi, wengine kufutwa. But mile kitu ndeza kujisaidia nayo, nilikuwa na tu savings. Tuliniokolea kidogo.
As they say, every dark cloud has a silver lining. There were businesses that did roaring trade at the time, but they were few.
I've been doing photography since 2012. Then 2019 comes, I started hearing about COVID, and everybody was fearing even to interact. We started losing bookings. I used to shoot like 3-5 weddings a month. And in January and February, I started receiving emails that they want to cancel. And so business became bad. So I needed to get money, to look for money to fend for my family. And I started by selling masks. No other business was doing so well apart from the business of selling masks, selling sanitizers. So I would go buy a box and sell masks, or buy a carton of masks and sell.
I sell baby stuff. Na saa hizo corona, watu walikuanga nyumbani. Lakini sasa yetu ilikuwa a bit better juu watoto wako home wanaboeka. So lazima wazazi wangekujia toys. But on the other hand, hakuna toys. Hata za kuuza hakuna. Simply because wenye wanatuuzia hawapati. So it was just draw for everyone. Yeah, we were all affected.
For the big corporates, the name of the game was innovate or perish.
With a repurposed aircraft, this aircraft, which is a state-of-the-art aircraft doing long-haul operations and can reach destinations over 14 to 16 hours away, we will be using the Dreamliner, as we know it, for our freighter operations to destinations as far as China, the UK, Americas, if the opportunities are there. We want to move what the farmer is growing in Kenya to outside where the product is required, and we are moving it out so that we can create value for the Kenyan population, and then to bring back the pharmaceuticals which is the vaccines back into this country for our people. This will do a lot for the airline in terms of creating value both ways.
By the first week of April, the number of infections doubled and rose to 110, and the first fatalities from the virus were reported in the country. This caused shockwaves around the country. Unprecedented stigma and paranoia kicked in. Many positively diagnosed patients would not even admit to what they were ailing from. With stigma hitting a high crescendo, the remains of early victims were disposed in a frightening manner. Often at night, with terrified burial crews in full hazmat suits, with families not even allowed anywhere near. This brought back bitter memories of the early HIV/AIDS patients decades earlier, where stigma had strongly stood in the way of logical action and discourse on the disease.
This morning, I visited the Kericho County Referral Hospital just to check on our level of preparedness in case of the numbers going high, as we are being informed by the people who are managing this situation, that as a county we are well prepared.
Still, infections continue to rise, spreading more and further from the capital to rural areas. The government, like the rest of the world, was throwing every weapon it had at the disease.
There shall be a cessation of all movement by road, rail, or air into and out of the disease-infected area, effective midnight tonight until otherwise notified.
Anticipating this move, Kenyans had days earlier been on shopping sprees, those who could stocking up for months, to an extent of causing artificial shortages of basic goods. In May 2020 alone, the country clocked 1,500 new cases. As COVID-19 picked pace, a new challenge was emerging: lack of adequate testing capacities for the many suspected cases.
One of the challenges is ensuring that our staff actually are protected, because you understand that healthcare workers are one of the group of people that are highest at risk. Training staff to ensure that they are capable to handle the COVID-19 cases, both the asymptomatic and the complex one.
We are prepared to accommodate at least one or two patients, especially those COVID patients.
Low pace of testing at the country's borders with Uganda, amongst Kenya's leading trading partners, caused severe cargo truck tailbacks that were running to the tens of kilometers.
Hakuna shughuli kutoka asubuhi tumefika huko tunafukuzwa, tunataka kupigwa, tunaambiwa sisi ni makorona, tuondoe korona upande. Kila tukipeleka upande tunafukuzwa upande. Result ya siku ile nikaona mpaka sasa sijapata.
Tangu nianze kupimwa sijaiona matokeo yangu. Nimepimwa sasa ni mara 7 na hakuna matokeo imeshaikuja hata moja.
But if lack of adequate testing capacity was a challenge, an even trickier curveball was lurking around the corner. Kenya's weather patterns unleash a cold spell in the months of June and July. It's a season that traditionally sees a spike in common colds and flu. And with COVID-19 virus now spreading to most corners of the country, Kenyans braced for the worst as they welcomed the cold season. By June 5th, the total reported cases had shot to 2,500, with 650 recoveries and 80 fatalities. The government and healthcare experts were scratching their heads for the remaining options.
So you feel it, eh? Yes. By the time you get to the immigration desk, you are it's just for the immigration officer to find out that it is properly filled, and then you are cleared. But now if you bring... We are basically here to see the operations at the border to ensure seamless movement of goods across our two sister nations. This, therefore, will reduce the turnaround time for this exercise.
That effective Friday, 27th March 2020, there will be a daily curfew from 7 p.m. to 5 a.m. in the morning.
Kenyans with a knack of ignoring government directives would attempt to test the authorities on this latest policy, only that this time around they were in for a rude shock. The message was clear. The nation was wrestling an unprecedented threat. Everybody had to pull their weight.
With the barrier that has been put up, it means we'd have to go to Naivasha, which is many miles away, while Gong is a walking distance from where we stay.
Hii sio kupanish wananchi, hii ni kusaidia kwa sababu ya hii COVID-19. Kazi yetu imeharibika, we are not doing anything. If they want to do total lockdown, no problem, but we are not going to pay rent, and we want the government to provide us with food and water and every single thing.
If we continue to behave normally, this disease will treat us abnormally.
The spreading health crisis was also fomenting an even bigger economic crisis. By mid-June, huge and small corporates were sending hundreds of thousands of workers either on retrenchment or unpaid leave.
We have taken some measures with regard to enhancing mobile money transactions. For instance, the elimination of charges on all transactions below 1,000. We've also expanded some of the limits, for instance, on the transactions. Banks will review requests by borrowers to extend their loans for a period of up to 1 year.
The Chinese contractor for the standard gauge railway sent 4,000 workers and 471 Chinese expats on unpaid leave. Local carrier Kenya Airways put majority of their 4,000 staff at 75% of their pay. East Africa Portland Cement Company announced voluntary early retirement programs as part of its staff rationalization plan. Major hotels such as Fairmont Norfolk, Hotel Intercontinental, Tribe, Dusit D2 would also follow suit and announce temporal closures. In the informal sectors, things were worse as public markets, construction sites and other spaces where Kenyans eke out a living had been shut. The suspension of travel from urban areas to rural areas almost meant inability to access their merchandise.
We also launched the Emergency Relief Cash Transfer Program, which saw the disbursement of some 305 million shillings, translating to a population of 1.127 million Kenyans.
Your Excellency, I want to very highly thank you. During COVID, we agreed, we had a memorandum of understanding, as it has been officially mentioned by the Honorable Minister for Labour, and the President went further to classify some of our produce as essential services providers. And during COVID and during curfew, they had an opportunity to access the external market.
As the cold spell dragged on, COVID infections were on the rise. Soon, hospitals were overflowing with patients. Bed spaces countrywide were running out.
The Machakos government has converted Machakos Stadium into a health facility. This stadium will house temporary mass screening and treatment areas, and will be able to isolate those who are found positive and treat them for mild and non-critical condition.
If bed space was a problem, the country's critical care capacity would also be severely stretched. Many patients lacking intensive care units would succumb.
Because of the nature and emergency nature of the requirement for oxygen. We are going to work with the Treasury to see whether we can be able to increase the oxygen cylinder supply via reduction of some of the taxes.
It was not only ICU facilities that were in short supply. Ventilators for patients in need of intubation also became a major need.
Moving forward, and as the numbers swell, we will definitely need more and more support.
With numbers of the infected continuing to swell, Kenyans were gripped with horror as they watched far-off places such as Italy, where infections were the highest outside China, with fatalities in the thousands. It was a battle of wits, with the government calling on Kenyans to prime their bodies by adopting more healthy diets.
Know how to fight stigma. Know how to keep yourself safe. Put on your mask.
The devastation of the pandemic was widespread. Prominent and dedicated doctors amongst those who paid the ultimate sacrifice in a fight to save their fellow countrymen.
Health and care workers have been on the front lines of the pandemic, but are often underprotected and overexposed. They need vaccines now. They and their families have already paid an extremely high price in this pandemic. Protecting the people who protect us is the right and smart thing to do.
It is really paining. I never knew death could pain until you feel you are no more. That's the time I felt COVID was real, and COVID is really with us, and it can kill anybody at any time. And he told me, just continue praying. My right lungs are damaged. I cannot remember what I did next. I only found people just full in my home. I was only shouting, my daktari, Hudson, you have deceived me. Hudson, you never told me the truth that you are going away.
By the end of the year, the country would lose prominent Kenyans from all spheres of life. Lawyers, academicians, politicians, even clergy, such as pilot Daudi Kibati, who passed on in April after his international flight to evacuate Kenyans stranded in New York. Tony Waswa Wetangula, brother and assistant to Westlands MP Tim Wanyonyi. Charles Bukeko, aka Papa Shirandula, who rapidly deteriorated and succumbed at Karen Hospital. Bishop Emeritus Silas Njiru, who had served as Meru's second prelate, would also pay the ultimate price while serving in Italy when he contracted COVID-19. The list was long. As the battle raged on, the World Health Organization was a strong partner to the government, providing strong communication and advocacy against the pandemic, as well as leading in prevention programs. As the year-end approached, infections had crossed the 50,000 mark, with 36,000 recoveries and more than 1,000 fatalities, according to official data. A ray of hope was finally emerging with the announcement of a breakthrough in the development of vaccines.
We've had some very encouraging news in the last couple of weeks. The World Bank Board of Executive Directors approved $12 billion in financing for developing countries to finance both the purchase of the vaccine and also to support the delivery of the vaccine. So we are working very hard at the international level to make sure that there is going to be vaccine availability to start in African countries as well as in the wealthier countries, and then we progressively phase in the deployment of this vaccine.
January 2021 brought in both good and bad news. The good being that the country was set to receive a batch of 24 million doses of AstraZeneca vaccine.
How are you? Where people can go with them for oxygen, like you can see, so you can store the vaccines there, have the ice packs on the side to maintain the temperature, but beyond that, they have with them.
The bad being that the country had now been invaded by 501.V2, a variant of the original virus.
Preliminary analysis finds the new variants to be more transmissible, and it appears to be driving the surge in new infections in the country and in the sub-region.
The government would respond by instituting the most severe travel restrictions witnessed to date. As the first batches of vaccines landed, all efforts would be directed at urging Kenyans to take the vaccines. First, workers in critical fields and those low in immunity, such as the elderly.
This is an exciting moment for our nation, receiving the vaccine for the first time in our country.
The vaccination exercise will commence in all our county referral hospitals, since the vaccines have also been moved there.
We encourage all that have access to these vaccines to get their shots as soon as possible to protect themselves adequately.
On 5th March 2021, there was relief as the first round of mass vaccination commenced with 1 million doses of AstraZeneca Covishield vaccine supplied under COVAX pillar.
We have embarked on vaccinating our people, starting with the frontline workers, extending eventually to the rest of the population.
Defying many myths that had earlier threatened to derail the vaccination exercise, Kenyans would turn out in large numbers to receive the jab. By the end of May 2021, close to 1 million vaccine doses had been administered.
We are also taking this opportunity to give the first vaccination injection to our healthcare workers. After healthcare workers, we are going to the security forces and teachers.
To not miss this opportunity and get vaccinated in time, we will be starting with Mandera East, and subsequently we will be rolling out to the sub-county teams.
All of us know that the pandemic exists, the pandemic kills. I saw the need of getting vaccinated so that first, I protect myself, I protect my family, and I also protect the other people whom I interact with.
Nairobi has a number of private facilities, nearly 406, and another 4,000 individually owned or individually run clinics. And we want to work very closely with the Ministry of Health to ensure that in this first phase, no single healthcare worker is left out in the vaccination.
By August that year, 2.8 million vaccine doses had been administered, including 800,000 for second doses. In the last quarter of 2021, COVID-19 infections were beginning to relent, with only 3,800 cases in October.
We have received 6,000 doses for 3,000 people, and we are starting with frontline workers, especially the doctors, clinic officers, and the nurses.
With slowing infections, the country could take a pause and reflect on its hits and misses regarding its management of this pandemic.
The President has this morning issued an executive order extending some of the containment measures to ensure that the ecosystem within which our children are going back to school remains manageable and remains constant and safeguards the health of our children as he pledged in his New Year message.
Every child is properly masked. Most of those masks they are wearing were provided by the government of the Republic of Kenya, together with our collaborators.
Among the hits include foreplanning and surveillance on the pandemic, working with all key stakeholders in the health sector in fighting the pandemic, strong public campaigns on COVID-19, giving the country the tools to fight the pandemic, quick thinking and development of makeshift health facilities and upgrading of existing ones, helping to fix the capacity gaps. Among the areas the nation could have done better are enhancing quicker access to personal protective gear for medics early on in the pandemic. And the country had low capacity of critical care facilities, meaning many serious cases could not be attended to in time. By November 2021, the trend of slowing infections continued, with only 1,700 new infections recorded. The country was getting confident it had seen the worst of the pandemic. Most restrictions earlier placed were relaxed. Unfortunately, the number of infections started to rise again, with 39,000 new cases registered in December, 26,000 new cases in January 2022.
While Omicron does appear to be less severe compared to Delta, especially in those vaccinated, it does not mean it should be categorized as mild.
But what is clear is that the severity of the disease has dramatically reduced amongst the infected patients, a positive sign of the effectiveness of the vaccine.
We are seeing huge investments related to COVID-19, and this is creating several possibilities and opportunities to accelerate action towards achieving health for all. At WHO, we've been working with countries to spend more and spend smartly on health by investing in the most impactful interventions, improving efficiencies in the health sector, and strengthening public financial management.
Today, we see encouraging signs of declining cases of COVID-19 globally, but we cannot forget the fragilities of our health system and the need to increase our resilience so that we can protect ourselves from potential disruptions that are still a reality.
With a looming general election and huge public meetings taking place, health professionals are worried about more COVID-19 infections.
Although reported cases and deaths are declining globally, and several countries have lifted restrictions, the pandemic is far from over, and it will not be over anywhere until it's over everywhere.
Interest in vaccines also seems to be waning, a trend that is now worrying healthcare experts. Is Kenya declaring victory over COVID-19 too prematurely? For the WHO, the world must embrace the tough lessons from the pandemic to prepare for the next emergency. The respected global health body recently broke ground for its African regional operation and logistics hub. The facility and similar ones in Senegal and Nigeria are centers of excellence in emergency medical training, with the capacity to respond to dozens of crises at a time.